Welcome to this lecture, still in basic pharmacology, and we are going to talk about routes of drug administration. Now, we have drugs, so how do they enter the body? How do we make sure that these drugs go to areas where they need to work? Now, we have to administer them. Now, for a route to be chosen, there are certain things that should be considered. One are the properties of the drug. What is the property of that drug that has to be given? And then, what are the patient requirements for this particular drug? So, those two factors, among others, can influence the route or the route or the way in which we have to give this medication or drug. Now, there are basically three routes of drug administration. We have what we refer to as the entero route. The entero route. We have what we refer to as the parentero route, and then we also have what we call the local route. So we are going to define them, or we are going to see how what they actually mean, and how are drugs administered through these routes. Now, the entero route is generally known as what we refer to as the oral route. But to be more specific, when we refer to the entero route, entero has a meaning or is inclined to what we refer to as the GIT, the gastrointestinal system or the gastrointestinal tract. So any form of administration of this drug along the GIT is broadly what we refer to as the entero route. Of course, the commonest is the oral. The commonest is when we swallow these medications expecting them to be absorbed in the small intestines or along the gastrointestinal system. Now, of course, this is the commonest. The entero is the commonest, and I would say is the safest route of drug administration, and absorption occurs along the GIT because it offers what we call a large surface area for absorption. But we also have it mixing with a different content, like for example food. When you swallow this medication, there are some that are given with food, and so there will be mixing of this drug with food, and so it will be influenced by so many things, pH among others, as it moves along the GIT. And some of these changes, like for example the pH, can facilitate its absorption along the GIT. Now, there are several advantages of this route. Remember, we say that it is safe. And so, one of the advantages is that it is a safe route. It is the most convenient route and the most economical as well. Drugs can also be self-administered through this route because you can give someone and they go ahead and take, especially with oral. And then it is non-invasive. In other words, you'll not have to pass a line for you to be able to administer this medication. However, as we said, anything good has a bad side as well. Now, the onset as a disadvantage, the onset of action is usually slower, is usually slower. Why? Because there is time required for absorption to take place. Now, there are some drugs that are actually irritant and palatable, and then therefore they cannot be administered. Now, however, they have found solutions to this. Sometimes they coat it with a sugary substance so that it can be palatable. However, there are those that are uncoated that are irritant and non-palatable, and so had to be administered via this oral or enteral route. Now, some substances may not be absorbed due to certain physical characteristics, like, for example, streptomycin. Irregularities in absorption can also pose, it can pose these drugs not to act quite well. And the list is endless. So those are some of the disadvantages of using this enteral route. Patient may forget some drugs might undergo what we call extensive first-pass metabolism. By this, we shall come to it in pharmacokinetics, but maybe just to throw some light, first-pass metabolism basically means for those drugs that are administered via the enteral route, they will have to first go to the liver before they eventually go to the systemic circulation. And we know that the liver, its role is metabolism. And so these drugs will be metabolized fast, and some of it rendered useless before it eventually goes to the systemic circulation. And so for all enteral drugs that are administered, they can undergo fast-pass metabolism. Now, we also have ways or forms in which these drugs are given enterically. Yeah? So in which ways are these drugs or medications given enterically or orally? Now, the commonest known are tablets. So these drugs can be given as tablets, and these tablets can be enteric coated, like, for example, aspirin, or they can be time-release capsules, or what we refer to as elixirs. Elixirs, a very good example is mouthwash. And then syrups, and then there are what we call emulsions. A syrup is in liquid form, and it is uniformly distributed. We also have emulsions. This is a combination of water and oil solution. Now, those are some of the forms in which drugs are administered via the oral or enteral route. Now, let's briefly talk about what we refer to as the enteric coated tablets. Now, these are coated with substances like cellulose, acetates, phthalates, gluten, among others. And the purpose of these, one is some drugs are irritable. Yeah, they are irritants. And so the purpose of these is not to so much irritate the GI, but also they are given, or rather these drugs are coated because we do not want them to be absorbed, maybe for example in the stomach, because we want them to go a little bit farther up to the small intestines where they need to be absorbed. And so they are coated so that they are not disintegrated by these gastric juices, whether alkaline or acidic in nature. And this will in turn prevent what we call gastric irritation, avoid destruction of the drug in the stomach, and provide a higher concentration in the small intestines where this drug is intended to be absorbed. And for some, it basically slows the absorption, and thereby or therefore prolong what we call the duration of action of this drug. Now, there are quite a number of advantages and disadvantages of this. One is the frequency of administration can be reduced because of the point that we said they can prolong absorption. And the therapeutic concentration is basically maintained for a long time to achieve what we call a steady state concentration, especially when the symptoms occur at night and they need to be treated. Now, the disadvantage is that most of these are expensive. Like, for example, metronidazole that is coated is more expensive than that which is not coated. Aspirin that is coated is more expensive than that which is not coated. And so the price comes in handy. Now, there may also be release of the entire amount of the drug in a short time. Remember, we said some of these coatings are made to prevent destruction or disintegration of this before they reach to an area of absorption. And so when they reach there, large amounts of this drug might necessarily be released and so bring about toxicity from this drug. So, ladies and gentlemen, that has been what we refer to as the entero route of drug administration. Remember, we said with drug administration, this is a way we have to get this drug into the body. And we said any form of drug administration along the gastrointestinal system is basically referred to as entero, but the commonest is oral. So in a nutshell, we say that with entero, the absorption of this drug will occur along the gastrointestinal route. And so, ladies and gentlemen, before we go to another route, let's do a test. When we come back, we shall then proceed to what we refer to as the parenteral route of drug administration.